Hello everyone, thank you for joining us today. My name is Beatrice Bitsash, I'm the head of product at Johnson Labs, and I'm pleased to be co-presenting with Vicky Reyes, the director of informatics and clinical decision support at Guideline Central. Together, we are excited to talk about how we can match patient cases to the largest clinical guidelines library in the world. As healthcare professionals, you all know how crucial clinical guidelines are for delivering evidence-based care. Our goal today is to show you a new way to make those guidelines instantly accessible when and where you need them. In this presentation, we'll explain how clinical practice guidelines, or CPGs, are currently used in clinical settings and why it's often challenging to access them during patient care. Then we'll introduce a new feature in our medical chatbot product that acts as a powerful assistant, allowing you to conveniently query and interact with a large, up-to-date and licensed clinical guideline library right at your point of care. This is the outline of our talk. First, we'll discuss what clinical guidelines are and how clinicians typically use them in a day-to-day practice. Then we'll describe how Guideline Central curates and prepares those guidelines, and we will touch on how those digital guidelines are currently distributed. Then we'll consider how clinicians and applications might query or search for information and the pros and cons for different approaches. We'll explain the challenges that make it hard to use and integrate CPGs at the point of care, both from a clinical workflow perspective and a technical standpoint. After understanding the problem, we'll introduce the architecture of our proposed solution, essentially how the medical chatbot works under the hood to overcome all the challenges. Finally, we'll show a live demonstration of the system in action and wrap up with how you can get started and what are the next steps. To start, let's begin with a brief introduction to Guideline Central. And Vicky, the floor is yours.
Hello, I'm Vicky Reyes. I am with Guideline Central. I lead the informatics efforts, and today I would like to go over a little bit of how we work with the guidelines. So our main role is to disseminate the guidelines and guideline awareness among the clinicians. We work with guideline authors and healthcare entities to transform content into educational materials and tools that can be used at the point of care. We partner with over 50 medical societies. And I need to go to the next slide. We partner with over 50 medical societies, and that number continues to grow because we work closely with the societies to develop our products. They become available at the same time the guideline is released in most cases. Guidelines form the bridge between research and practice settings. They cover a variety of aspects: prevention, diagnosis, treatment, quality of life, shared decision-making. Guideline development often begins as clinical trials are wrapping up phase 3, when safety and efficacy of interventions in question are established. Guideline authors review the evidence that was generated under strict conditions in the clinical trial settings and translate it into the real-world settings. The final guideline includes recommendation statements for optimal care and also documentation of the processes, evidence, and reasoning that led to these recommendations. The full text guideline is a combination of text, tables, algorithms, and images. It can easily span over 100 pages. Assuming clinician is aware of guideline existence to start with, browsing through 100 pages at the point of care is not the most efficient way to find answers. And this is where Guideline Central comes in. First, we help to increase the awareness of the guideline existence. Second, we work with societies to extract information that would be most useful at point of care and compile it into different formats: pocket guides, provider summaries, patient summaries, quizzes. Third, we create digital point of care versions of the guideline. We split the content into dedicated elements: text, recommendation, headings, figures, tables, lists. We tag elements with appropriate metadata. For example, recommendation elements are tagged with inclusion criteria, recommendation scope, and recommended action type. The final product is a set of data elements arranged in a specific order and tagged with applicable metadata. We use these sets to render point-of-care content on our website and mobile apps. We also make the structured data available to third parties via API. Guideline Central partners with over 50 guideline authoring medical societies. Licensing this solution containing the official Guideline Central content, such as pocket guides, would ensure you have the right permissions to utilize these critical guideline recommendations in the quickest, most user-friendly format possible. And with this, I hand it off to Dia.
Thank you, Vicky. Now let's go through some technical details about how would you use the CPGs in a real use case. So even though those guidelines are available, accessing and using them during patient care is often challenging. Imagine you're with a patient and you want to check the guideline recommendation. How would you do that today? Perhaps you go to a website, find the PDF of the guideline and scroll through it. Or maybe you have a printed binder of summaries. Either way, it's not very convenient in the middle of an appointment. This slide shows a few examples of real guidelines to illustrate the scope of what we're dealing with. For instance, in this first example, you can see a consensus report on diabetes management in chronic kidney disease. It's 16 pages long. It contains text description, tabular data, images, and charts. Another example here is the Clinical Practice Guideline for High Blood Pressure in Children and Adolescents from the American Academy of Pediatrics, which spans 72 pages. Even something as straightforward as the guideline on treating nosebleed from the ENT Society is 21 pages long. Now, imagine you're in a busy clinic or emergency department. If a patient comes in, their child with high blood pressure, are you going to stop and read through the 72-page document to find a specific threshold or treatment recommendation? Probably not. In reality, what happens is clinicians don't have time to fully read those documents on the spot. They might skim an executive summary if one is available, use memory of reading it previously, or just rely on their general knowledge and experience. This isn't ideal because details matter. The guideline might have specific recommendations based on patient characteristics that could be missed. In practice, accessing clinical guidelines is often cumbersome and doesn't fit smoothly into the clinical workflow. The information is all there, but it's locked up in long texts that are not optimized for quick reference. You usually have to break your workflow. Leave the EHR, search for a PDF or a website, scroll to find the right section, and interpret it. All of this while the patient is waiting in front of you, which is not only stressful but sometimes impossible given the time constraints. Those examples lead directly to the question on the next slide. Why are CPGs so hard to use in front of patients? There are several reasons why. We have already touched on a few, but let's break them down. So first of all, clinicians struggle to stay up to date with evolving recommendations, given the volume and velocity of changes across specialties. Then updates are spread across disparate systems and formats on society websites. They are embedded in journals or sent via email or shared through EHR alerts, making it easy to miss or overlook critical changes. As we saw, guidelines are lengthy and often very detailed. Dozens of pages of text are overwhelming to navigate when you have a patient in your exam room. It's not feasible to read or even skim all that content during a short consultation. Important details can be buried in paragraphs of text, making quick retrieval of a specific recommendation like finding the needle in a haystack. Often a patient has more than one condition. You might need to reconcile 2 or 3 guidelines at once. For example, a patient with diabetes, heart failure, or kidney disease. There are separate guidelines for each, and those might have to be considered together. It's nearly impossible to do that on the fly without a tool to help synthesize all that information. In short, using CPGs in front of patients is hard because the information isn't immediately accessible or digestible in real time. This leads to the under-utilization of guidelines, even though clinicians want to follow them. Practical barriers get in their way. Our mission is to remove those barriers. But let's first take a closer look at different technical options for querying CPGs that are currently available. The first and most traditional method is using a search engine based on keyword search, exact matches, or fuzzy logic search. This is relatively simple. It has been around for a long time. However, it's not ideal for CPGs because information is often spread across multiple pages and there is no semantic understanding of the content. As a result, it becomes hard to synthesize answers from multiple locations in a document, especially when recommendations depend on context or on multiple variables. So clinicians are left to manually parse through the returned snippets, and which breaks the flow of care. A second and more advanced option is to use generative AI or LLM-based methods, and there are several options for that. The first one and most simple one is to ingest the full guideline into the LLM memory and ask questions via chat. But in practice, this doesn't scale well. Context windows are limited because most models deteriorate past 32K tokens, so important content gets cut off or is missed. It also requires ingesting the full document every time you want to query it, which is both computationally expensive and slow. A second option would be to fine-tune an LLM using curate pairs from guidelines. While this is relatively easy to implement, it suffers from hallucination risks and cannot reason across long documents or multiple sections. It still performs poorly when queries don't match the training data. Then you can also pre-train a new LLM on CPG. This approach involves continuous pre-training over the full set of guidelines to create a dedicated CPG model. While attractive in theory, it's not trivial and very costly process, with similar risk of hallucinations and loss of generalization. Like fine-tuning, it still struggles with context reasoning across sections. Another idea would be to convert the CPGs to structured format and query via structured languages. This is highly accurate and fast and deterministic without hallucination, but also labor-intensive to build, and it requires technical expertise to query in an effective way. Finally, there is the idea to build a RAG framework, and this is our recommended approach. In a RAG system, the guidelines are split into chunks, indexed into a vector database, and retrieved based on semantic similarity before generating a response. So this is a solid modular framework with a low risk of hallucinations and supports white box architecture where the system can explain what it is doing. However, it requires careful pre-processing due to the complexity of the guidelines document. Many contains tables, diagrams, and charts, which are harder to parse and reason over. So here is the overview of the architecture that we are using for the medical chatbot guidelines query feature. So as an input, we have the guidelines together with the metadata provided by Guideline Central. Those go through a pre-processing process where the schema is unified. We might extract summaries for the guidelines or for the most important sections. We have scripts for detecting sections, subsections, detecting and structuring images, tables, and diagrams, and also for chunking larger sections into smaller parts. Obviously, the section detection and diagram interpretation is not necessary given the high quality data provided by Guideline Center. But we do support custom guidelines in the medical chatbot, so those guidelines which do not have metadata can be processed using those automatic steps. After the pre-processing, data is ingested, we calculate embeddings for the section content, and we store everything into a vector database. Then the user comes and asks questions via a chat UI, and we have the guidelines agent, which is able to analyze the prompts and plan the steps necessary to create a response. So it goes through query analysis, maybe identify some relevant filters inside of the user prompt, or does query expansion when necessary in order to ensure that the retrieval part covers all relevant information. Then it goes through the retrieval process, so communicates with the knowledge base in order to identify the most relevant guideline for to be used for answering the user question. If necessary, it refines the query in term when no relevant information is gathered from Elasticsearch. Then, based on the question asked by the user, it goes through the target one or several guidelines which might be relevant and analyzes the content of those guidelines. When in most of the cases, more sections are relevant to the question, so we apply re-ranking to those questions to identify the most relevant ones, and then we the agent goes ahead with generating the response. So as I said before, we are able to ingest new guidelines, but we also are able to update the guidelines as soon as as updates become available. We also support custom guidelines, which can be dropped in an S3 bucket, for instance, if you have your own set of guidelines outside of Guideline Central, so you can just drop them on S3 bucket on an Azure Blob Storage, and they will be automatically processed and included into the clinical guidance knowledge base. So let's go through a practical example. So for instance, here the user will enter a question: what therapy is recommended in a patient with sensory neural hearing loss that started 3 weeks ago? Okay, so once the guidelines agent will see the prompt, it will analyze it and come up with a plan. So it identifies the fact that it needs to search for medical documents related to this disease, with specifically focus on the recent onset, and it will get the relevant guidelines from the knowledge base. So it identifies the guidelines. It will go through. It will go fetch more information about those target guidelines. So see the sections, all the charts, decision flows within the document, and will analyze them with respect to the question. So based on the information, it will generate the retrieved information and the information which is targeted by the user. It will start generating a response. And you see here the response to the question together with the treatment protocol, all details available in the guideline. So how will this work in practice? The first thing you have to do is go to Guideline Central and subscribe to the guidelines according to your specialty. You can see here a selection of specialties together with a number of guidelines associated with available for each one of those. Once you have your subscription, you need to validate it inside of the chat. So you have to log in there and ask for validation. Once it is validated, you'll see it available under your available tools and knowledge bases. Then you can start querying via the chat. So you can ask general question about a certain disease, how to diagnose it, or how to treat it, or you can also ask questions about your particular patient. You can either copy paste the entire patient note into the chatbot and ask, what is the diagnosis or what treatment should you suggest. Let's see how this looks inside of the chatbot. So once you log in, you'll see this type of interface. If you click on the clinical guidelines tab, you'll get access to all your available knowledge bases which have been validated prior, and you can also ask for validation for new knowledge bases. Then you can start asking questions. For instance, this is a disease-focused question about autism. So what are the recommended treatment options? So first of all, the chatbot gives you the diagnosis steps for this disease, and then also the treatment options with very precise information about the exact medication to use, how to manage pain, and so on. Right? So a lot of information which might be relevant for the user. So given the structure of the response, you can go directly to the section of interest for you and read more, or you can also access the original guidelines, the PDF of the document, the PDF of the guideline, and search for more information or validate whatever assumptions you have. A second example is ask about a certain patient, right? A short query. So you have a patient with nosebleed with an anticoagulant medication. What to do with that? So the chatbot responds with some recommendations, right? What to do, like nasal compression or nasal packing in patients with increased bleeding risk, or also maybe other more complex steps to do, like reversal of anticoagulation or withdrawal of that medication. You have also additional considerations or limitations identified within the guidelines. Of course, you can access the content of the document to double check on some images or procedures, or go into more depth if you have time and if you think that's necessary. Finally, we have a more complex example where you copy paste fragment from a patient encounter. Here we have a 72-year-old male which is experiencing hearing loss. So he has other symptoms as well. So occasionally he is dizzy and unsteady when walking. He did not suffer any accident or infection or surgeries or head trauma. He does not have diabetes or hypertension, and so on. So you can include all the history of the patient and then ask the question at the end. So, what's the most likely diagnosis, and what tests should be performed on this patient to validate the assumptions and to validate this diagnosis? So once you ask the question, you send it to the chatbot. The AI agent will provide you with relevant information, like what are the diagnoses, what's the most probable diagnosis, so age-related hearing loss, what are the diagnosis criteria and tests to perform, and also what management action you should take, like patient education, providing maybe strategies, communication strategies, or hearing aids, and also, you have information about differential diagnosis. So maybe this can be more complex disease like Meniere's disease or tinnitus. In this particular example, you can see that 3 different guidelines were used to generate the response, especially for the differential diagnosis. So you can see that AI agent is able to take information from different sources, combine it, validate it. So here it said that Meniere's disease and tinnitus are probably not a good diagnosis, but you should take that into account because the patient does not complain about certain elements those 2 diseases are focused on, or some of the symptoms which are listed in those diseases guidelines. How can you get started and experience with the chatbot firsthand? So the chatbot comes in 2 different offerings, a professional one and an enterprise one. The professional is a software as a service offering. You have the URL here. You can sign up via LinkedIn or using your enterprise email. All our users get a 7-day free trial with access to all available features. After the trial ends, you can subscribe to continue using the existing features, and get first-hand access to new features. The professional version offers access to medical conversations with knowledge bases which are updated on a daily basis, literature review features, document Q&A, querying of the guidelines, and so on. The enterprise version is private to your team and data, so you can deploy it on your air gap environment and use it on PHI containing information or your own enterprise documents. You have unlimited number of users and groups, role-based access management, single sign-on, and also API access if you want to integrate the chatbot with your regular workflows, or if you want to integrate, for instance, with your EHR data. Now, a few points, particularly for the decision makers in the audience. We designed this solution to be easy to integrate. Johnson Labs has a decade of experience as a healthcare AI expert, and we specialize in working with sensitive medical data and embedding AI into real workflows. Our platform and models are built with compliance, privacy, and reliability in mind. In fact, our new suite of medical language models has advanced industry benchmarks in NLP performance, meaning you're getting best-in-class technology under the hood. We've been focused on healthcare AI for 10 years, and that experience shows in the accuracy and safety of the answers that are provided by our systems. Guideline Central, on the other hand, brings the content authority with years of partnership with medical society. So this is a powerful combination of trusted content and trusted technology. So we invite you to try out the medical chatbot with Guideline Central's guidelines and see how it can improve your practice and healthcare product. Thank you for your time and attention. We encourage you to sign up for a trial or reach out with questions. Have a nice day.